Hello, everyone. Thank you for joining our webinar on digitizing healthcare with iOS health and fitness apps. So, good morning to everybody, and I'm Mukta Ashok, and I'll be your moderator for today's webinar. As we begin, I want to take you through a few indicators so that we can interact better during the webinar. You are looking at the attendee interface of GoToWebinar. Now, as you can see, there is a viewer window on the left. This window will show you everything that we will be sharing from our screen. You also have an access to a control panel, which is on the right hand side from where you can type in your queries and share your comments. Um, we'll be reviewing your questions as they come in, and we'll take them up towards the end during the question and answer session. Also, the webinar is being recorded, and everyone will receive an email with a link to view a recording of today's event. I'll start off with talking about Suyati. So to begin with, let me introduce you to our company, Suyati Technologies. Suyati provides marketing technology and integration services for companies that wish to combine the best of breed solutions and create a unified approach to customer acquisition. We enable system integration between various CMS and CRM platforms and a slew of e-commerce, marketing automation, social media listening, email and social marketing, and customer service systems. CRT's custom technology solutions have been deployed in companies in the US, Western Europe, and Australia, and we have helped many enterprises leverage the web, cloud, mobile technologies to acquire customers through integrated digital marketing. We have strategic partnerships with various technological giants such as Salesforce, Symphony, and MongoDB. We are also a Microsoft certified Go partner, and Suyati is based out of Chicago with product engineering capability out of the US and India. Now, with our in iOS, we tailor to meet your unique business needs. Our solutions are developed to provide you a stable, customizable, and secure means of presenting your wares to the world. We have an expert team that offers an array of services including database management, networking, client server integration, enhanced UI, sensor technology, animation 2D, 3D graphics, and game development. Now I would like to introduce you to our featured speakers, Rajo and Sulabh. Rajo is a senior iOS developer at Suyati Technologies. He's also specialized in mobile user experience and application design. Starting from estimation and designing to coding and development, Raju has enormous development expertise in mobile. And Sulabh is currently working as an iOS developer at Suyati Technologies. He brings in rich experience that includes working on large and complex mobile projects. He's also specialized in core data and service integration. And Sulabh has worked across verticals like real estate, e-commerce, and healthcare. Now, social media tags, you can use the hashtags and handles to post questions, follow us, or even tag us. Now, I'll walk you very quickly through the agenda of the day. We'll start out with introducing you to the Apple's Health Kit, and then we'll be fetching live data, health-related data from iPhone. And Sulabh and Riju will take you through a demo of the app. So I think that's all from my end. Now, I would like to pass it over to Riju. Over to you, Riju.
Thank you so much, Mukta, for the introduction. I will start off by explaining what an health app is. So, if you have an iPhone running on iOS 8 or iOS 9, you might have seen an app named Health. Health app gives you access to your health and fitness data. It also helps to share health data between different apps. It acts as a centralized hub for all your health and fitness information. It shows the heart rate, active energy, cholesterol, and all kinds of health related data. Sulabh will take you through the app for a better understanding. Sulabh, can you please?
Yeah, thanks for the introduction, Richo. Uh, Moving on to the health app, you can see health app is pre-installed with all iOS devices after iOS 8. So let's take an info. So this shows the dashboard of the health app, which comprises of the average steps a user has taken, his walking or running distances over a period of time, flights he has climbed. Also, there is a we can add this data for a period of time, like for a day, for a week, for a month, and we can view the history of data on various data points that we have covered during this period. Moving on to the second tab, which is the health data. Health data comprises of different quantitative analysis of the health data that our health app has provided. It comprises of body measurements like body fat percentage, body mass index, height, weight, etc. Also, in the fitness section, we have active energy burned, flight climbed, Nike fuel integration, steps users has taken, and data like that. It also features a My Profile section where the user can provide their date of birth and his various biological details. Various features such as sleep, vitals, and nutrition related data can be viewed from the health app. And also, if a user needs to add some data points to his dashboard, he can just go to this steps tab and you can choose the option like show on data board. This will make the data available in the dashboard. As you can see, the steps data has been added to the dashboard. Also, one of the other features is the medical ID. Medical ID is a very critical feature in the health kit. It gives the user the details of the various medical conditions and various allergies and reactions that he has been suffering, and the person to which the details can be the details can be passed in case of any emergency situations, like if the user is suffering from any critical situation and if his phone is locked like this, we can just on the bottom left section we can see the emergency. On tapping that, we will move to the emergency section. On the top bottom left, we have a medical ID option. On clicking the medical ID option, you can see the basic details of the user, such as user's name, birth date, and the various medical condition, allergy, and reaction. There's also an option where he has provided the detail in case of any emergency. We can just add the either the doctor's details or his nearby relatives number. So in case of that medical emergency, we can contact him on the various medical precautions that we can take at first. So this is a very critical feature provided by the health app, and it's very useful for health kit users. So that's all for the introduction. I will move on to Richo.
Thank you, Sulabh. The Health app you just saw works with HealthKit, which is an API introduced in iOS 8 that provides an elegant way to store and retrieve users' health data. It works directly with health and fitness devices like iWatch and Fitbit devices. HealthKit is designed to manage data from a wide range of sources. Third-party apps can access these raw data for each sources merging data themselves. Sometimes health data can be sensitive and users would like to keep it secure. Because of this, HealthKit grants users control over their data by providing fine-grained control over the information that apps can share. The user must explicitly grant each permission to read and write data to the HealthKit store. Users can grant or deny permission separately for each type of data. The HealthKit data is only kept locally on the user's device, which means that data is kept in the device only. is not accessible from any other devices. For security, the health kit store is encrypted when the device is locked. The health kit store can only be accessed by an authorized app. Since HealthKit is a framework provided by Apple, its benefits and user experience cannot be matched with any other frameworks available as of now. To speak of few, it separates data collection, data processing, and socialization. To explain better, HealthKit allows you to focus on implementing only the aspects you are most interested in, leaving the other tasks to more specialized apps. Let's take an example of a group of friends who decided to join a daily step count challenge. Now, each person could use his or her preferred hardware device to track the steps, but they could all still use the same social app for the challenge. Now, the second point is it enables automatic data sharing between apps. For developers like us, we no longer need to download APIs or write custom code to share with each app. Also, users don't need to manually set up the connections between their apps or import and export their data. Most importantly, users still control which app can read and write data to HealthKit store. However, as soon as the user grants permission, apps can freely and frictionlessly access each other's data. HealthKit also provides a richer set of data and a greater sense of context. Mm, which means that by accessing a wider range of data, each app gets a complete view of the user's health and fitness needs. In most cases, an app can modify its metrics or advice based on the additional information from the health kit store. As an example, a training app could suggest a post-workout snack based not only on the number of calories burned, but also on the type and amount of food the user has eaten so far that day. HealthKit is being used by 90% of the health and fitness app available on the store, which makes it an integral part in developing any health-related apps, ensuring we become a part of ever-growing ecosystem. Now let's dive deeper to HealthKit framework. All objects in the HealthKit framework are subclasses of HK object class. Main properties includes UUID, which is a unique identifier for the particular entry. Source revision, or which gives the information about version of the app or device. Metadata is a dictionary containing additional information about that entry. Also, device, which represent a hardware device that generated the data stored in the sample. Also, HealthKit objects can be divided into two main groups, characteristics and samples. Characteristics represent items that typically do not change, like birth date, blood type, biological sex, and skin type. Samples means uh, samples are where the most of the health data is stored. These samples represent data at a particular point of time, like number of steps users walk each day or fluctuation of levels in blood sugar over a period of time. Some properties of sample class are sample type, start date, and end date. Now let's take a look into the divisions of samples. There are four divisions for samples: category samples, quantity samples, correlations, workouts. Category samples are type of data which can be classified into finite set of categories. Quantity samples can be stored as numerical values, which includes user's height, weight, as well as other data such as the number of steps taken, the user's temperature, and their pulse rate. Correlations are composite data containing one or more samples. In iOS 8, HealthKit uses correlation to represent food and blood pressure. You should always use a correlation when creating food or blood pressure data. Workouts represent a physical activity like running, swimming, or even play. Workouts often have a type, duration, distance, and energy burn properties. You can also associate a workout with a number of fine-grained samples. Unlike correlations, these samples are not contained within the workout. However, they can be queried using the workout. Now, we have a small demo of how we can integrate HealthKit into an app, which will allow us to access data from Health app. So, Sulabh will take you to the demo. Sulabh, can you please?
Yeah, okay. Okay, so moving on to the example app. Moving on to the example app, we will first showcase how to enable HealthKit from our code. So this is a basic Xcode view. Moving on to the capabilities, we can, on scrolling down, we can see the HealthKit option made as on. On choosing these options, our app will integrate with the default HealthKit that is provided within the app. So on adding this HealthKit, then entitlement will be added to our project as well as various other frameworks. HealthKit framework will be added. Now, moving on to the demo. So the app we are focusing consists of two views basically, patient view and a doctor view. The patient view comprises the details that a specific user can see on the various data that he has been storing inside the health kit, and he can have a check on the various changes that he has been focusing over a period of time, and also he will get a realistic view on every day how the values has been changing, and he can have a realistic view of his various health related data. The second view comprises of the doctor view. Doctor view is basically a view that can be used for doctors to groom a group of patients based on some common health data and provide solutions for the users, like what are the training plans that he can focus and what all uh, health precautions that he can choose, and all these data that we provided are dynamically created based on each user's health data points. So moving on to the patient view. On clicking patient view, we are going to onto the health access screen. This screen allows the user to provide what all data that a user can be accessed from his health kit. As we can see, active energy, date of birth, heart rate, height, sex, steps, weight. These are the various data points that our app needs to capture from the user's health kit. So on clicking all categories on and clicking allow, what we basically do is fetch the required data from our health kit and display. So our app displays the age, gender, the heart rate, step count per day, user's recent weight, user's height, and a prescribed plan that has been suggested by the doctor. The plan that we have shown here can be comprises of sub plans such as on the food diet that he can choose, or the various training that he can suggested by the doctor, and also the various data metrics that he can be used. Now moving on to the doctor view. So the doctor view comprises of the set of patients that the doctor has grouped based on their specific characteristics, and it also provides the data time whether data has been recently used. Now moving on to the first user, the user details has been provided to the doctor, and his most recent heartbeat, heart rate, and the steps he has covered per day, and his weight and height has been provided. These are only a small amount of data that we have requested to the app. We can also access other specific data types like blood pressure, user's blood sugar level, and on basis on the type of the requirement, we can access the data that we need. In our app, it's basically the amount of steps user has been working, and on based on that, we will provide the required action plans that user should follow in the coming days. And a doctor can check whether the user's data metric point has been correctly being used, and he can evaluate whether he has been following the plan correctly. And after completing a successful plan, he can suggest any new plans with more relevant data. So moving on to the API section, we'll have a look at the various types of data that we can infer from the health. So body measurements such as body mass index, body fat percentage, height, etc. can be inferred from the health kit. And also scalar data types such as the energy he has been burning, the distance walking, distance cycling, and the also integrating Nike fuel. These are the some set of data that different types of apps can infer on the basis of their requirements. Also, we can see that we can analyze different heart rate, body temperature, blood pressure levels, oxygen saturations. These are the different variety of nutrition levels such as vitamin details can be inferred. So this will give us a amount of the data that we can infer from the health kit. Also, different users may be inputting the data in different units. So while accessing the data, we can choose which types of unit that we need to prefer. For example, for choosing the height of a user, we can provide the meter unit such as metric prefix centi. It will provide the height of a user in centimeter form. Also, we can choose which data type that we need to display for a specific unit such as in height. Either we need to display it in a centimeter format or in inches format or in separate feet representation. So there's a lot of data points that we can use using HealthKit. So that's all from my end. So I hand over to Mukta.
Okay, thank you guys. Thank you, Raju. Thank you, Sulabh. It was a pleasure to have you both on board. Now it's time for the question and answer session. Uh, so we are ready to address your questions. Folks, please do type in your question using the question feature on GoToWebinar. Okay, we have first question for the day. Does the health app work with hands like Fitbit and MI Band?
As of now, there is no direct integration with Fitbit, but what we can do is we can create an app. There are APIs, open source APIs available for Fitbit. We can pull data from Fitbit and we can write it onto the health kit. Same with MI Band also. So at this point of time, there is no direct integration.
Thank you, Raju. I hope that was quite clear. Moving on to our next question. Is there a way to keep date in a server so that when I switch my device, I can access them? Okay, it's data. Sorry. Is there a way to keep data in a server so that I can, when I switch my device, I can access them?
Okay, in that case, what we can do is we can write an API for that. We can pull the data from HealthKit, and we have to build our own server for that for the time being. And we can fetch the data from Health app, and we can put it on the server, and we can access it anytime we want.
Okay, one another question that many of the users has recently been find is like how HealthKit integrates with other research kits and care kit as well as home kit. How HealthKit provides a health data in a holistic view. Like iOS provides a home kit where the users can be monitored based on their suppose if a user is inside his home, various activities can be monitored using HomeKit, and this can be integrated to the Health Kit. And for question about the Research Kit is an open source API where users can provide data for various research related activities. So in earlier times where if one want to volunteer for a research activity, we need to move to a place and to have conduct several exercises and find that data and that to be stored there. So instead of that, we can use our health kit data and we can voluntarily provide the data for the research purposes. And several of the organizations are collaborating for handling the large amount of data. So more the data we have in our hand, it will be very easily we can check for the various deviations in several users and based on various other research activities. This data is very critical and can be used. And about the care kit provides the data like suppose if a user is suffering from any asthma conditions or any other critical condition. So on suppose we have a data point where above that the user is in very serious threat. So if our data point reach at that level, the care kit can provide the message to our nearby doctor or our one or two relatives that his this data level has been reached a very critical level and what are the necessary steps that he can do and also on post operational evaluation of a user like after a user has been coming from a operation and we need to evaluate his health data we can use this care kit. So care kit will be coming in this early April provided by and it is also an open source.
Okay, that was quite informative. Thanks a lot, Sulabh. So that is all the time we had. Now, please look up for a follow-up mail that will alert you on the on-demand status of the webinar so that you can review any material you have missed or you could simply go over again. So any other further queries will be taken offline. You can reach us at our social media or you can simply drop us a mail at webinar@suyati.com. So that brings us to the end of our webinar. On behalf of Rijo, Sulabh, and our team at Suyati Technologies, I would like to thank you all for joining us and taking your time to attend our webinar. Have a great day.